I'm Josh.
I'm Gabe.
From Balanced Body Rehab. Today, Gabe and I are going to show you a correction of forward head carriage or forward head posture. Forward head posture can cause increased wear and tear on the lower part of your cervical spine and upper part of your cervical spine and cause lots of different symptomology in your upper back and neck. So we're going to try to show you how to correct that. The biggest thing we need to do when getting the head, trying to get the head back, is correction of this upper thoracic spine here, because that gets rounded, it pitches the head forward then, so then the head can't get back what we call over the hump. So one of the biggest components of this is trying to get the neck back. In order to get the neck back first, because the head tends to tilt up, so bring your head up there, Gabe, because the head tilts up like that, then the back of your neck gets tight here, so you have to rub back here with your fingers first. Gabe, you want to get in there first? So Gabe's rubbing the back of his skull with his fingers there to loosen up those muscles and to decrease the tone there, so that we can then get the head retracted and elongated back there. So good job there, Gabe. And now try to bring the neck back. We call this the stinky cheese exercise. Imagine stinky cheese in front of Gabe and he's going, ew, and pulling his neck back. And so when he does that, you see the elongation there. So he needs to get elongation of these muscles, but down below in his upper back, those joints are trying to slide back and extend. So to get that extension, he really has to get what we call this neck elongation or axial lengthening here to get the extension here. Once he gets, we'll call it the head on top of the hump, that's great, but we want to then try to get it behind the hump to get the head to roll on the back side of the hill if we can. So if you have the flexibility, we're going to have you keep encouraging that back, and you can even use your fingers to kind of give yourself a little bit of a push back to help get the head behind the hump, and that's truly getting those joints to slide down there. Once you get that, you can lift the chin just a little bit to kind of encourage that a little bit more. We don't want to go, into this movement, which then would just jam your upper back, but you just use that head tilt to generate the weight going backwards a little bit more to get the head behind the hill just a little bit there. But our goal is to get the head over the hump to get those joints to slide back. And the ideal sensation here is you're going to feel a little bit of an achiness right here in the upper back because those joints are sliding down. So an achiness right at your collar area there is ideal in what we're looking for. All right, if you get any pain, any sharp pain, then just back it off and go to the basic stinky cheese retraction. If that hurts, talk to your clinician or a professional you're trusting with your neck care and try to get a modification. All right, thank you.